very rare ASD of sinus venosus variety of inferior vena cava type. That is very rare finding. This very rare variety of ASD. So in the ASD, what you see, this is sagittal image showing both IVC and SVC. You see this is IVC, this is liver, and this is anterior one, this is most posterior one. This is right atrium, this is right ventricle, this is tricuspid valve, and this portion is superior vena cava. This is inferior vena cava. This is superior vena cava. This is left atrium. And you see left atrium is communicating at the same time IVC is also communicating with right atrium. And this is the right lower pulmonary vein is directly communicating with this right atrium. So in case of sinus venosus ASD of SVC type, you will find right upper pulmonary vein is communicating with SVC or right atrium. But in case of sinus venosus ASD of IVC type, you will see right lower pulmonary vein is communicating with right atrium directly, almost where the IVC also joins, the right lower pulmonary veins also joins. So this is the ASD. You see, this is the ASD. Very rare finding, very rare variety of ASD, sinus venosus ASD of IVC type, sinus venosus ASD of SVC type. You can see the vein is coming and blood entering into right atrium, flow is left to right. You see how the blood is coming from left atrium into right atrium. This is the what you see, the coronary sinus is quite dilated, and coronary sinus is dilated because of left superior vena cava is connected with coronary sinus, draining into coronary sinus. So coronary sinus is dilated in this case. You see the coronary sinus. This is coronary sinus. This is coronary sinus. You see. You see the right ventricle is quite large compared to left ventricle. Right ventricle severely dilated. You can see the coronary sinus dilated. This is the better view. This is parasternal long axis view. See, there's this left atrium. This is left ventricle. This is atrioventricular groove, and this portion is dilated. You see, this is coronary sinus. In this case, coronary sinus is dilated due to left-sided superior vena cava draining into coronary sinus. This image, what you see, this is coronary sinus. This is very important image. This is parasternal short axis view. This is where the main pulmonary artery divides into right and left pulmonary artery. This is right pulmonary artery. This is left pulmonary artery, and a structure that is anterior to left pulmonary artery branch. This is coronary sinus. If coronary sinus is having this feature that left-sided superior vena cava is draining into coronary sinus, then this image will have this type of image will appear. So ultimately, in this image, coronary sinus, you see this is part that is communicating coronary sinus. So this is left-sided superior vena cava draining into coronary sinus. But if it is any pulmonary vein draining into coronary sinus, and that will be posterior to left pulmonary artery. that will not be anterior, because the upper part of the skin is a most anterior part and lower part of the skin is most posterior part. So this structure is anterior to left pulmonary artery branch. This is left pulmonary artery branch. So ultimately this structure is anterior to left pulmonary artery. That means left side vena cava is draining into coronary sinus. Moving image you see, you can see here moving image, this sign image. You see now you see this is coronary sinus. Okay, this is coronary sinus, sorry, this is left side vena cava draining into coronary sinus. You see here this is coronary sinus. You see the blue flow means the flow is away from the probe, that means from away, that is probe blood is going into coronary sinus from left side vena cava, the blue in color. You see this is blue in color. So ultimately supraesternal view will give you how the left side vena cava is draining, whether left side vena cava is present or not. Supraesternal view will give you better picture, but even in parasternal short axis view you can get this thing if the part of coronary sinus that is coming anterior to left pulmonary artery branch, anterior to left pulmonary artery, this is anterior to left pulmonary artery. You see here this is right main pulmonary artery, right pulmonary, left pulmonary artery, and this structure is anterior to left pulmonary artery. So you see this anterior to left pulmonary artery. So this image shows that coronary sinus is dilated because of left side vena cava. Again you can see this structure here. This is main pulmonary artery, right and left pulmonary artery, and a structure is coming here. This is the size of ASD and the ASD size. So ultimately the thing that you have to know, is whenever you have to locate the sinus venosus ASD, you have to make sagittal image showing both IVC and SVC in one view. That will give you exact picture whether the sinus venosus variety of IVC or SVC is present. If flow is coming near the IVC, then that will IVC type of sinus venosus ASD. In that case, right lower pulmonary vein is communicating directly. In case of SVC type of sinus venosus ASD, right upper pulmonary vein is directly communicating with right atrium through SVC. So this is the very rare variety of ASD that has got IVC type sinus venosus ASD of IVC type. Thank you.